Good morning, and I'm just going to give a brief update on heart failure admissions and readmissions and how this impacts not only our patients but the economy. And what this has done to result in Medicare initiatives and how these initiatives impact us, our hospitals, and us as providers. CMS or Medicare beneficiaries, a large number of those do have a diagnosis of heart failure. And so the cost, there are a lot of high number of admissions, and in the decade of the year between 2000 and 2010, annually it was estimated there were 1 million inpatient hospitalizations for heart failure. And the average length of stay was 5 days as compared to around 11 days in Europe. If you look at why people, once they are discharged from the hospital, come back in within a 30-day period, the majority of those are due to acute exacerbations of heart failure, around 35% of those. How this impacts our patients? Well, if they are coming back into the hospital, they're not doing as well. They're not being able to stay at home and do the things they want to do. But also there's a decline in cardiac function with each subsequent admission. And this can actually be a prognostic indicator as how they are performing and doing. Economically, the American Heart Association has estimated if we do not implement things to curtail the cost, by the year 2030, we could be spending $70 billion annually on heart failure treatment, with 50% of that being due to inpatient care. So what they did, under the Affordable Care Act in 2010, CMS was charged to implement the Hospital Readmission Reduction Program. Currently, the national average is 21.9%, but each year we are measured based on our quality and readmission rate, and we are subject to be penalized by our next year's Medicare reimbursement if we are above the national average. So this is a website that's now currently available to the public. It's called Medicare.gov, and it's Hospital Compare. So any savvy consumers who are interested to look and see how hospitals compare to each other and their 30-day readmission rates or other quality measures can just type in a city, state, hospital and directly look at that information. So what CMS was hoping, not only to reduce costs, but for us to pay more attention to not only how we take care of our patients in the hospital, but how they fare once they leave the hospital, and help with a smoother transition back into the community, whether it's to the home or skilled nursing facility or rehab. This was a news brief that I saw that was released by Kaiser Health on August 4th, that over 50% of hospitals over this next year will be penalized based on this Hospital Readmission Reduction Program. Medicare expects to recoup $528 million over this next year in penalties. Now, this isn't only heart failure, but the other diagnoses that they're looking at as well. So where do we stand at our institution? We did make the grade, and the national average is 21.9%, and that's where we're at. Other institutions in our metro area didn't fare as well, but we can't be complacent. We got to continue to push forward, because as hospitals and programs begin implementing programs to help reduce their 30-day readmission rate, that national average will decline. Many of us sometimes may get frustrated because we think things are out of our control as far as reducing readmissions, but the majority of those admissions and readmissions are preventable. In the past, a traditional heart failure admission may look like this. We would tune patients up with a little bit of diuretics, give them some discharge instructions and prescriptions, and send them on their way. And we would expect to see them back soon, because it was often a revolving door. So fortunately, at the Heart Hospital, we have a number of service lines at our disposal. We're very fortunate to have a congestive heart failure clinic that is well established and now staffed with a full-time APN, Shay Oxford. And we have very skilled and experienced registered nurses on staff. We have implemented an initiative to have our inpatients that come in with heart failure to be followed up in 7 to 10 days, and if they can't be seen by the APN, by their provider in satellite clinic or primary care physician or provider. We also have the capability of remote pulmonary artery pressure monitoring. We do use the CardioMEM system in appropriate patients, and this is managed through our heart failure clinic as well. We also have we have a transitional care RN at the hospital who will contact our patients, and this is all patients who are discharged within 2 business days, to make sure that they receive their prescriptions, got them filled, make sure that they receive their follow-up appointment, and answer all their questions. We also have information we provide to our patients that is available in written and DVD format for patients to take home as well. We also have a wonderful social work staff to help with that transition back into the community, to help set up home health and other dural medical equipment if needed. We also participate with the Mended Heart Support Group and Visitors Program. We do have visitors that make rounds weekly and on an as-needed basis. It has been shown that patients who are visited by a Mended Hearts visitor are more receptive to their provider's instructions and are less likely potentially to be readmitted. We also fortunately have a sleep lab in our facility and have screening implementation in place. As we know, heart failure and sleep apnea are tightly interwoven. We also we continue to refer patients that are appropriate for ICD and CRT therapy. And of course, we have our fantastic cardiac rehab. And it has been shown that heart failure patients who exercise have a reduced risk of admission and also decreased risk of all-cause mortality. And as we've seen this morning already, we have very talented surgeons and interventional cardiologists with our structural heart program to help our heart failure patients as well. We now have 4 electrophysiologists on staff to help with arrhythmia management. As we know, many heart failure patients develop arrhythmia complications such as atrial fibrillation and ventricular arrhythmias. And we continue to utilize evidence-based medicines, and we also have the capability of requesting consultation for advanced therapies for those patients who are appropriate or may need advanced therapies such as left ventricular assist devices or transplant. I want to thank you for your time and attention and enjoy the rest of the program. Thank you.